Well, Summit County Public Health says it is taking a flood of phone calls from residents who are wondering if they need to get a measles vaccine. The concern comes as measles outbreaks have been reported in other states, including now Pennsylvania, and nearly 160 cases down in Texas. While no cases have been found in Ohio this year, local health officials telling our News 5's Bob Jones now is the time to talk about who does and does not need the vaccine.
For preschool teacher Shania Payne, it's a priority to follow the vaccine schedule for her baby girl, Janila.
I keep up with all her vaccines that way that she doesn't catch anything, like she just got her RSV vaccine.
Janila isn't ready for the measles vaccine yet, but her older brother is vaccinated against it.
He's 8 now, so he got his measles vaccines, but that's something I like to keep up to date with to make sure he doesn't get that, because when a child gets that, it can really harm them in a bad way.
Dr. Erica Soboleski with Summit County Public Health says questions are pouring in from people who want measles vaccination information, mostly because of an outbreak in Texas. 158 measles cases have been reported in that state this year.
I think that's a crazy outbreak to have in Texas. It's a lot going on with that.
With the large outbreak in Texas, is there a concern that it could become a problem here in Ohio?
Absolutely. I mean, the world's a small place anymore.
And cases continue to rise, including a measles infection reported this week in Pennsylvania. Measles is airborne, extremely infectious, and kills 400 to 500 people a year, according to the CDC. So who should get the measles, mumps, and rubella vaccine? Dr. Soboleski says, first off, children.
The current vaccine schedule calls for 2 vaccines in the childhood vaccine, so between the age of 12 and 15 months, and then between 4 and 6, that when you're entering kindergarten age, you usually get that second booster.
She says adults who don't have evidence of immunity should get the vaccine also.
Most people are protected with just 1 dose.
But she added some adults considered high risk, such as healthcare workers and international travelers, may need 2 doses. According to the health department, the latest statistics show that 91% of people eligible for the measles vaccine in Ohio have received one. Health officials prefer 95% or greater to achieve herd immunity. Dr. Soboleski says those with life-threatening allergies, a weakened immune system, or are pregnant should not get the vaccine, and those born before 1957 don't need it.
Because it was endemic within the United States and they were exposed to it.
If you can't find your vaccination status, Dr. Soboleski says call your doctor or check with schools for possible records.
Our hope is to bring more awareness and have people make that choice for themselves to protect themselves.
In Akron, Bob Jones, News 5.
And we've been telling you for years that Ohio's vaccination rates have been on the decline. According to the CDC, 89.2% of kindergartners in our state had the MMR vaccine last school year. That number has been below 90% since the pandemic began, after dropping from 92.4% in the 2019-2020 school year.